All right, so the next set of the instruments, these are universal curates, or we can call it Columbia curates. So in some country they call it Columbia, and then in some country we call it universal. So I think in Mahidol University, at least I know that they call it universal. So there are three kinds of universal curates or Columbia curates. The first one is 1314, and then the middle one right here is 4R4L, and the right one right here, the right side of me, is 2R2L. So the difference between these three are the lower shank of the instruments right here. Okay, so the tip of the instruments right here, this part we call the toe area because it looks like a foot. Okay, and then the part next to the toe area right here is the lower shank. So you can see that these three instruments, they have different length of the lower shank. The one that has the shortest shank, we call it 1314, and the one in the middle, okay, is 4R4L, and the one that has the longest lower shank, we call it 2R2L. And 1314 is kind of universal. We can use it like in both anterior and posterior teeth. And for 4R4L, that the shank is kind of in the middle between these two, this one is used for the posterior teeth only, okay? And we have 2R2L right here that has the longest lower shank. This one we use it for anterior or the premolar area. All right, so 1314 for overall of the teeth, okay, both anteriors and posteriors. 4R4L for the posteriors, and 2R2L from for the anteriors and premolar. So we're going to introduce you first with the 2R2L, okay? So for the 2R2L, the way I remember is that whenever you insert the instrument into the sulcus of the patient, okay, first of all, you need to line the instruments by using the handle as the guide, okay? If you line the handle of the instrument parallel to the long axis of the tooth. In this case, I'm gonna do number 1 okay, tooth number 1. So I line the handle of the instrument with the long axis of number 1, and then the tip of the instrument needs to insert into the interproximal area, okay. And you can see if you line it like this, you can see that the lower shank kind of curved towards the mesial side of number 1. Okay, so if it curve toward the mesial side of number 1, if you use the handle as a guide, okay, handle is parallel to long axis of the tooth. So this end of the instrument should be used on the mesial of number 1, okay. And if you want to do the distal part, okay, you need to change, okay, the tip of instruments, okay. We're gonna start with the number 1 on the mesial first. So when we insert the instruments, usually I like to insert the instruments from their line angle, okay, and then you can curve towards the interproximal area. Remember, the curate is used for the subgingival calculus, so you insert into the subgingival area of the tooth, and then you use the short stroke to curate the calculus out, okay. And same thing, okay, once you use on the mesial of number 1, you can also use this instrument for the mesial of number 1, or for the mesial of number 1, as well. And you can also use this tip of the instruments to on the distal of number 2, and distal of number 2, and then distal of number 2, okay. However, if you want to do like the other half of the teeth, you need to change the end, okay, from this side to the other side. Same like a principle. So you use the handle of the instrument, okay, as the guide, okay, and then the handle needs to be parallel to the long axis of the tooth that you want to work on. So for example, this one I want to work on number 1, okay. So the long axis of number 1 is parallel to the handle of this instrument, and you can see once you insert the tip of the instrument into the interproximal area, okay, you can see that this one, the curve of the instruments kind of insert into the distal part of number 1, okay. So for example, if you want to test whether this is right, so you can try to insert on the mesial of number 1. You see, if you get like parallel, if you get the handle of instrument parallel to the long axis of the tooth, okay, this curve cannot be like it's not curved toward number 1 mesial. You see, so you cannot use this instrument on the mesial side of number 1. You have to use it on the distal side of number 1 like this, okay. So you have to curve towards the tooth, and then you use this side of the instrument, okay, go insert into the sulcus of the patient, and then use the short stroke, okay, like this, okay, to do the root planing on this side. And then you can also use it, okay, on the distal part of number 1, 2, and also number 1, 3 right here. You can also use this instrument, okay, to insert on the buccal or the labial part of the tooth as well, like this, or here, or right here, okay. And same thing on the mesial side of like quadrant 1. If you use the other side, you can also insert on the labial as well. I like to do it half. So if I use this side, I would insert on the on the mesial part of the labial, and then curve toward the mesial, and then do on the interproximal. Same thing on this side too. So you can insert and then clean on the buccal of the instrument, on the labial of this tooth, and then curve towards mesial. And if you use the other side, okay, we go back to number 1 on the distal, as like the second time I told you about this one. So same thing, if you use on this quadrant on the distal, you change the quadrant to the other one, you have to use it on the mesial, okay, so use on the same side. And also this instrument, okay, make sure that it's parallel to the long axis of the tooth, okay. This one curved toward this area, so you use it on mesial of number 2, and also on the mesial of number 2, 3. And same principle will apply, okay, to the palatal surface, okay. But once you change the palatal surface, you have to change the size. So for example, if you use it, okay, use this end to clean on the mesial of number 2, 3, okay. Once you go to the palatal surface, okay, so you have to flip the instrument, okay, and then make sure the end of the instrument insert into the interproximal area, and you can see my handle still parallel to the long axis of the tooth, okay, and this end of the instrument curved toward distal of number 2, 3. So you use it to clean the distal part of number 2, 3, to clean the distal half of number 2, 2, and to clean the distal of number 2, 1, okay. And also you can also use this type of instruments to clean the mesial of number 1, mesial of number 1, 2, and mesial of number 1, 3, okay. And if you want to use on the other side, on the distal part of number 1, 3, you do the same thing. You have to change the end, okay, to the other end, and then you apply the same principle. The handle of the instrument parallel to the long axis of the tooth, it curved towards distal of number 1, 3. So you use it towards the distal of number 1, 3, towards distal of number 1, 2, towards the distal of number 1, 1. And also, if you change the quadrant, it's gonna be on the same side, but it's gonna be mesial of number 2, 1, mesial of number 2, 2, and mesial of number 2, 3. Alright, so this is it for the anterior teeth. You can also use this 2R to L for the premolar area as well. So actually, like, you will not use just only the just not only the canine, okay, you can also apply this technique, okay, to use on the premolar area like this as well. If you can insert the instruments far enough, okay, but actually for the for the premolar and molar area, it's better to use 4R4L because it's basically designed specifically for the posterior teeth. So I will introduce you guys for 4R4L and 1314 later on. Okay, so we change to 4R4L. For 4R4L, it's a little bit different in terms of how you're gonna figure it out which side that you want to use for cleaning the teeth. Okay, for the principle of posterior teeth, usually we're gonna use both both side of instruments to clean the teeth. Okay, so the sharpness of the instruments is on both sides, on the left and the right. Okay, so you use both sides to clean the teeth, and the way you insert the instrument, whether it's right or not, this one you use lower shank, okay, as a guide to insert the instrument. Okay, so remember, if you clean the anterior teeth, you use the handle as the of the instrument to be parallel to the long axis of the tooth. But for the posterior teeth, you have to use the lower shank of the instruments to get parallel to the long axis of the tooth. Okay, and then if you get the lower shank parallel on the to the long axis of the tooth, for example, this one is number 24. Okay, you put the end of instruments into the interproximal area, long axis of the tooth parallel to the lower shank of the instrument. So this is the right side to use. And then you have to, you will know that once your lower shank parallel to the long axis of the tooth, the handle of the instrument needs to point outside the patient's mouth. This is correct way to use it. If you use the other side, okay, you try to use it in an incorrect way, this is wrong. Okay, I'll show you how I use it wrong. So if you use this side, you see, if you insert the instrument, okay, into the interproximal area, the end of instrument into interproximal area, but the lower shank of the instrument kind of parallel to the long axis of the tooth, the handle of instrument you see right now is go back into the patient's mouth. Okay, this is wrong. Okay, so the handle of the instruments need to go outside the patient's mouth like this. Okay, so this is correct way. It has to go outside. It has to point toward the anterior of the teeth. Okay, and when you use this one, okay, you can insert the instrument. Okay, now you know that okay, we have to use this side to clean all the buccal surfaces, okay, of this posterior teeth. You can use this end to clean both mesial and distal for the posterior teeth. It's a little bit different from the anterior teeth. Okay, when you apply the Wichurat principle. So for this one, usually I normally want to kind of try to curve the blades again, okay, towards the tooth. So whenever you insert instruments, okay, try to make your handle, okay, parallel to the long axis of the tooth like this, and then your blade's gonna curve towards the tooth without hurting it, because if you insert it like this, okay, your blade is gonna be 90-degree angle to the surface of the tooth, and 90-degree angle is not correct angle to work, right? So you want to work around 70-degree. So for 70-degree, you need to kind of close the blade a little bit towards the surface of the root. So usually I normally insert the instrument like this. So I try to kind of go back like this to close the blade, okay, and then insert the instruments, and then you can use this side to clean mesial of premolar. And then you can also insert the instruments, okay, below the gingival margin like this, okay, and then clean on the buccal half, okay, on the mesial half of the buccal of this tooth as well. And you also use the same instruments, okay, But if you want to do the distal part, okay, of this premolar, you have to change the blade by kind of angle, okay, the blades, okay, and then close the blade. Okay, so this side you close the blade by kind of like do the motion, so your hand's gonna be a little bit inside the patient's mouth in order to close the blade. But if you go to the distal part, okay, your hand's gonna angle out the patient's mouth so that you can like close the blade, okay, and then you can insert this instrument into the distal half of this premolar area and then clean this one. Okay, your canal cell like clean on the buccal surface like this as well by using this side of the blade like this. Okay, and you can also use the same side, okay, to clean the next tooth on the mesial. You see, I kind of angle and then I close the blade every time I insert the instrument into the sulcus like this. And then you use this one to clean on the buccal surface as well. Sometimes you can also clean from the distal to mesial like this, okay. And then once you change to the distal, you have to use the other side of the blade, which is this one, okay. So you have to close the blade, okay. So I turn like this, and then you see that my blade is closed, okay. Usually I close the blade first like this, and then I kind of open the blade a little bit, okay, just a little, so that it can work, okay, to clean the calculus out, okay. And then you can also change the blade like this to the other side and clean on the mesial of molar. You use this side, okay, the same blade that apply on the mesial of molar to clean on the buccal area like this. And then if you want to do the distal part, okay, you have to use the other side of the blade, okay. So you flip the blade like this, okay, and then you close the blade, okay, by turning your hand. Looking at my hands, okay, I turn, okay, like this to close the blade, turn it out. And then you insert the instrument in and clean the distal part of this molar. Okay, you can also clean the distal buccal as well by using this end of the instrument. Then mesial again, look at how I turn the instrument. When you go change from the distal, okay, you use one side of the blade, and you change to the mesial, you have to use the other side of the blade and then close the blade, okay. So you have to turn your hand and turn your instruments, and then goes into the sulcus and clean, okay. You use the same part of instruments, okay, the same blade that you clean the mesial to clean the buccal of this tooth. And then you end up with the distal like this. You have to close the blade, okay, insert the instruments in, and then use the other side of the blade to clean the distal of this tooth like this, okay. And this is how you use 4R4L to clean the posterior teeth. And same thing, if the posterior teeth, okay, you use this side to clean all the mesial and distal for the for the buccal surface. Once you change to the palatal, okay, you cannot use the same instruments, okay, because you see, if you want to use the same instrument, okay, or the same side of the instrument to clean on the palate, you have to use the lower shank to be parallel to the long axis of the tooth. Your instruments, okay, the handle will face into the patient's mouth, which is not correct. You have to change, okay, to the other side, okay, to the other end of the instrument in order to make it work. So once you change to the other side, you see the lower shank parallel to the long axis of the tooth, okay, your instruments facing outside the patient's mouth. And this thing, this side is the same thing. So you clean, okay, you use this to clean both mesial, okay, and then distal, okay, of this palatal side, okay. You can use mesial, you can use this on the mesial, distal, mesial, this one, and also on distal, okay. And actually for this one, okay, if you use it on the palatal, okay, of quadrant 2, for example, you can use this instrument, okay, on the buccal of quadrant 1, okay, like this, on the mesial and distal of quadrant 1. And if you want to change to the palatal of quadrant 1, you change the end of the instrument again, so that it will insert into the palatal surface nicely, okay, so that the lower shank parallel to the long axis of the tooth, and then your handle still facing outside the patient's mouth, okay. And then you use this to clean the palatal surface, both mesial and distal, and also you can also use it to clean on the mid palatal surface of the tooth as well, like this. And same thing, these instruments will be the same one as I show you at the beginning of the buccal surface of this one, okay, of quadrant 2. So again, the way I kind of get used to it is that, like, once you start with, for example, if you start with quadrant 1 on the buccal, okay, you use it on the mesial distal, okay. Once you want to use it on the palate, you change the side, okay, and then you can use it on the palate. And then once you complete the palatal side of the first quadrant, you go to the buccal again, okay, with the same instruments, and then you can clean on the mesial and distal. And every time you change from buccal to palatal, you have to change the instrument, okay, to the other side, and then you use this side to clean on the palatal surface. And then again, the palatal surface right here on quadrant 2, if you go to quadrant 3, okay, you can change to buccal again without changing the end of the instrument, okay. And then you clean on the buccal like this. I normally clean like a system like this so that I won't miss any, like, you know, I don't have to think much about instruments. So I clean on the buccal side, and then every time I change from buccal to palatal on the same quadrant, I change instrument again. And I can use this end to clean on the palatal surface, okay? Oh, sorry, on the lingual surface of quadrant 3, okay? And same thing, if I want to change to another quadrant, I don't need to change the end of instrument. I just need to change the area. So if you clean on the palate, on the lingual, okay, you can just change to the next quadrant, but clean on the buccal surface. You can use the same end. But once you want to use, you know, the different, you know, if you want to change from buccal to lingual, okay, for the same quadrant, you need to change instruments, okay, to this one. If you change from, either you're gonna change the instruments for the same quadrant, or use the same instruments, okay, but change to another quadrant, but change the size. So this one will work on the lingual, and this same end will apply on the buccal of the opposite quadrant, okay. And this is for the posterior. The last one that I will introduce, this is 1314, okay. This is the shortest one, okay. It has the shortest lower shank for the 1314, so it can apply the principle of both 4R4L and 2R2L. So if you use it on the anterior teeth, okay, for example this one, okay, you have to apply the 2R2L technique, okay. So you use the handle as the guide, okay. Handle needs to be parallel on the of the long axis of the tooth that you're gonna work on. And then if it curves toward which side, you use that, okay, for cleaning on that side. For example, this one, it curved toward the distal, okay. The end of the instrument insert into the proximal area, and it curved toward distal of number 1-1. You have to use this side to clean number 1-1 on distal, number 1-2 on distal, number 1-3 on distal, or you clean it on the number 2-1 on the mesial, number 2-2 on the mesial, or number 2-3 on the mesial. And for the anterior, every time you change from mesial to distal, you use the other end, okay, like this. And then this one, okay, the handle of instruments parallel to the long axis of the tooth, and you see it curved toward distal of number 2 3. So you use the instruments to clean at the distal of number 2 3, distal of number 2 2, and distal of number 2 1, and also on the mesial of number 1 2, mesial of number 1 mesial of number 1 1, mesial of number 1 2, and mesial of number 1 3. And because you clean the mesial on the labial surface, if you want to clean the palatal surface, you have to change from mesial, okay, and then to the distal, okay. So same principle. So the handle, okay, needs to be parallel to the long axis of the tooth like this, and then the end of the instrument go into the interproximal area. You see it curved towards mesial of number 1 3, okay. So you use it for cleaning this one, because if you go like this, okay, it won't work on the mesial of number 1 3, because like once you get this guy parallel, okay, the handle of instrument parallel to the long axis of number 1 3, and you try insert into the mesial of number 1 3, it won't work, okay. This end used for the distal of number 1 3, distal of number 1 2, distal of number 1 1, and mesial of number 2 1, mesial of number 2 2, and mesial of number 2 3, okay. And if you want to do distal, okay, of number 2 3, you have to change instrument into the other end, okay. You can use it, okay, on the distal of this quadrant, and then mesial of quadrant 1 like this, okay. You can also use the instrument, okay, the same way as 2R2L to clean on the mid lingual of the tooth as well, or mid palatal of the tooth like this, okay. And same thing, okay, if you clean, all right, like the distal of like this quadrant, okay, you change the mesial of this quadrant, right? But if you go down to the lower anterior teeth, okay, you have to figure it out again by, you see, the handle instrument needs to be parallel to the long axis of the tooth, okay, and the end of the instrument insert into the interproximal area. You see it curved toward the distal of number 3 1, okay. So you use it on the distal part of this tooth, distal part of this tooth, distal part of this tooth, okay, or mesial part of number 4 1, mesial of number 4 2, mesial of number 4 3. And if you want to do like the other side, okay, or the mesial of like number 3 1, you change the instrument and insert into the mesial, and mesial, or distal of number 4 1, distal of number 4 2, and distal of number 4 3, okay. And then you can change, okay, this. Once you finish the distal of number 4 3, you can use it on the lingual, but you have to change to the mesial, okay, of the same tooth like this, mesial of this one, mesial of this one, but distal of this quadrant, distal of this quadrant, and distal of this quadrant. And then I use the same instruments, okay, to clean on the mesial of number like 3 3, and mesial of number 3 2, mesial of number 3 1, and then go to distal of number 4 1, 4 2, and 4 3, okay. So this one used the same principle as 2R2L. But for the posterior teeth, because this one is universal, you can also use it for the posterior teeth. You apply the principle of 4R4L. So for the posterior, okay, so you have to use the lower shank, okay, of the tooth as the guide. Sorry, of the instrument as a guide. So lower shank needs to be parallel to the long axis of the tooth, okay, and then the handle face outside the patient's mouth. And you use this instrument to clean all the buccal, both mesial and distal of this quadrant. Okay, so you can use this one to clean mesial of number 2 4, okay, and then all the buccal, and distal of number 2 4, mesial of number 2 5, distal to 5, mesial of number to 6, okay, mid buccal, curve toward distal, mesial of number to 7, clean all the buccal surface, and then clean the distal of number 27. And then this one will work, okay, on the palette of the opposite quadrant, okay. It's same principle as like 4R4L. So again, if you want to change to the other side, okay, on the same quadrant, you have to change the end of instruments. So I finished cleaning on like quadrant 2 on the buccal, right? So I want to clean on quadrant 2 on the palatal. I need to change the end of instrument to the other side like this. And you can see lower shank parallel to the long axis of the tooth, and then the handle of the instrument face outside the patient's mouth, okay. This is correct. So if you want to use the other end, try to clean this area, okay, you have to do it like this, and you see the handle will face inside the patient's mouth or the patient's throat. It's not gonna work, okay. You can't clean like this. It's kind of not natural at all. So you use the right side, okay, of the instrument to clean, okay. All right, so same principle of 4R4L, and then I normally like clean all around one quadrant, and then I change to another quadrant, but move from the palatal to buccal with the same end of the instrument to clean all this area. And then again, for the same quadrant, if I want to move, okay, I change the end and then move to the palette like this. And then once I get to the bottom quadrant, okay, I change from palette to buccal with the same end of instrument, so it can be applied towards this side of the mouth. And then once I finish all the buccal, I need to change the instrument again to clean on the lingual, okay. So I use the other end like this, okay, to clean on the lingual. And then again, once I finish cleaning on the lingual, I want to change the quadrant, I move towards here. Right away, you don't need to change the side of instruments. You can clean it on the buccal like this. And then again, once changing from the buccal to lingual, you need to change instruments, okay, for the same quadrant. And then you can use the same instruments, okay, but different tip, okay, to clean on the lingual. And that's it for 1314, okay. For 1314, it's universal, so you can use this 1314 to clean all the anteriors, okay, and also for the posterior as well on the buccal and lingual, okay. So the difference between these three in terms of the shank is that the 1314 has the shortest shank, okay. You use it to clean in general. Usually I use this 1314 Columbia for the patient who doesn't have much probing depth, because the lower shank is kind of short. So if the patient has really deep pockets, okay, this short shank will not be able to reach down there much. So if the patient has really deep pockets, I prefer to use 4R4L or 2R2L more. Especially 2R2L is very useful for the anterior teeth where the patient has really deep pockets, because it can reach down there very much. Okay, it can reach down to the bottom of the pockets. For example, if the patient has 7-8 millimeter pockets, you can reach it down there very well, because the shank is very long, that you can insert this shank down more, okay. And also for the 4R4L, the shank is long enough as well for cleaning on the posterior teeth when the patient has really deep pockets. For example, on this side, for example, this side the patient has a little bit of pockets right here, so you can also use the instrument to insert a little bit deeper with the 4R4L, rather than using the 1314 that has shorter lower shank, so you cannot insert into the sulcus much compared to like the 4R4L. Okay, so that's basically it for all the Columbia like curates 13, 14, 2R2L and 4R4L. Okay, and you can also call it universal curate as well, but as I tell you, in some company or like some country they call it Columbia. Okay, so it's better to know both names so that you know what it is. So again, 13, 14 has the shortest like lower shank. Okay, and then like the medium one, okay, is 4R4L, and the longest lower shank is 2R2L. Okay, 13, 14 for the everything, both anterior and posterior. This is very helpful when you open the practice. Okay, have this in hand with the sickle so that you can clean, subgingival calculus in the gingivitis patients. But if you want to do like, some perio like work, okay, 4R4L and 2R2L is very helpful. Okay, 2R2L for the anterior and 4R4L for the posteriors.